Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and today we're going to talk a little bit about fat transfer. Now, this is something that is very popular with some doctors, and I used to do a lot of it before fillers had become so predictable, so available, and so long-lasting. Now, fat is a very positive thing because it's plentiful. Most people have adequate fat to harvest. It's a natural product, so it's our own tissue, and we can inject it. You can inject large volumes of it and use it to fill little things or big things. And there's some disadvantages of fat. Number one, you have to harvest it either from the belly or the butt or the thighs, so that's a separate site. Some people will freeze it and store it, but if not, and you do multiple procedures, then you have to harvest it multiple times. And also, when you inject fat, if you inject it in the face or wherever you're injecting it, you lose some of it. So normally, you have to do it several times. So there are advantages and disadvantages. Another relative disadvantage is it's hard to get rid of if you don't like it, okay? So people that do it and do it well have great success with it, and they put it in the temples, the nasolabial folds, the cheeks, all over the body in various defects. So we're going to talk about this, and I'm going to basically show you a video of how we do this, how we harvest the fat from the abdomen and inject it in the face. I may or may not have before and after pictures because this is basically a technique video that I've had numerous requests to film. So we're going to show you about fat transfer. This is a free video. I have a for-purchase video series on cosmeticsurgeryeducation.com. Check it out. If you're studying cosmetic surgery or if you're experienced and just want refresher video on contemporary techniques, it's cosmeticsurgeryeducation.com, and I have virtually all head and neck procedures, hours and hours, hundreds of videos on numerous procedures. I'm Dr. Joe Niamtu. All right, so what we're going to do is instill some of our tumescent anesthesia in the periumbilical region. And this is a standard Klein solution. 1/10% xylocaine, 1 to million epinephrine. Our goal is to stay in the subcutaneous area. Okay, so we're going to begin here, and we're just going to take our scalpel blade and make a little puncture just inside the umbilicus. It's really important to prep that well. We're using a 10 cc syringe with a little 3-port bullet harvester, and we'll put this in. And again, the only really thing you want to do is make sure that you're above the rectus, and by putting negative pressure on this, it's very easy to get plentiful fat out of the average person. If people have had liposuction before, then it may be scarred down and a little harder to get the fat. And if you stay in the subcutaneous plane, and by pinching the skin with my hand, I'm also feeling the fat coming out, so I know how much is coming out there. And if you're going to take a lot of fat, more than 100 cc's or so, you probably want to do it symmetrically so you don't have just a unilateral reduction. So you can see our fat is coming out, and we'll come back in a couple minutes. So here's our preliminary harvest here. Now, there's a lot of ways you can process this. You can just let it sit upright in the supernatant and infranatant, which is the lidocaine and the oil and the ruptured blood cells, and we'll float up to the top, and you can separate it that way. Many people centrifuge this. There are special preparatory devices that do that for you. You can simply take this and put it on a gauze and let everything absorb in the gauze, and then recapture the fat. You can see the shiny oil surface there, and then you can just kind of recapture the fat here. It's another way to do it. And people that do a lot of this have a lot of strong ideas about the viability of the adipocytes. So you can see that was 10 cc's, and we're going to lose about half of that just in the non-fat areas. So that's ready for injection. Now, another thing you can do is you can emulsify this. And again, some people feel that this affects the viability, other people don't. Go back and forth here, and it's going to mix this into a nice, creamy, easily injectable substance. So again, going in the different tissue planes, and unfortunately our ink is running and has really marred up our surgical site in my gloves. Blot, please. And so this is our placement of the fat, and we're going to do some in the lips here, and we'll show you in a second. We've made a pilot hole with an 18 gauge needle right here, and we'll insert our cannula. And the important thing is to thread this directly through the center of the lip. And you don't want to go in and out of the plane. That's called porpoising. You want to stay in the lip, and you want to inject a homogeneous bit of this as you come through. And then it's very important to put your little finger in the side of the mouth right here. And she's going to stretch the lip, and I'm pinching the pilot hole so we're not squirting the fat back out. So that homogenizes pretty well there. Let go. Okay. So that's our lip. Previous scar, and that's why that's bruised. But what I'm going to illustrate right now is you can take a little bit of your leftover fat and use this to massage to smooth this out, because frequently it is lumpy after you inject, and this will help give you a smoother surface, and you can actually use the side of your syringe if you want to do this, just to help kind of smooth out things that are a little lumpy bumpy. So that's pretty much how we do our fat harvest and fat injection. There's many ways to do it. This is just kind of the way that we've evolved. We used to do a lot more of this before fillers had become so effective, and we do a lot less now, but it's still a very handy thing for surgeons to have in their armamentarium. I'm Dr. Joe Niamtu, lovethatface.com.